Post-ICU syndrome, often referred to as PICS, is a common experience for people who have been in the intensive care unit. This condition can affect anyone who has spent a significant amount of time in the ICU, regardless of their age or health status before their stay. It can be, well, a scary and confusing time. Patients may feel overwhelmed by the sudden changes in their health and environment. Patients often face new challenges after leaving the hospital. These challenges can range from physical limitations to emotional and cognitive difficulties. They might feel weak and tired. This fatigue can be persistent and make daily activities seem daunting. It can be hard to think clearly. Cognitive issues such as memory problems and difficulty concentrating are common. Many people struggle to get back to their normal routines. Simple tasks can become challenging, requiring extra effort and support. This happens because being in the ICU can be very stressful for both the body and mind. The environment is often intense and overwhelming. Machines help with breathing and medicine controls pain. These interventions, while necessary, can contribute to the overall stress experienced by the patient. Bright lights and constant noise make it difficult to sleep. Lack of restful sleep can exacerbate both physical and mental health issues. The experience can leave a lasting impact. Many patients find that their time in the ICU continues to affect them long after they have left the hospital. It's important to remember that PICS is treatable. With proper medical care, therapy, and support from loved ones, recovery is possible. With the right support, people can recover and live full lives. It's a journey, but one that can lead to a fulfilling and healthy future. The main cause of PICS is the critical illness that landed someone in the ICU in the first place. This could be due to a variety of severe health issues that require intensive care and monitoring. Serious infections, surgeries, and injuries can take a toll on the body. These events often necessitate prolonged medical interventions and can lead to complications that extend beyond the initial illness or injury. Lengthy hospital stays, especially those involving life support, increase the risk of PICS. The longer a patient remains in the ICU, the greater the likelihood of developing physical and cognitive impairments. Certain factors make some people more vulnerable. These include the severity of the illness, the patient's overall health before ICU admission, and the presence of other medical conditions. Older adults are more susceptible, as are individuals with pre-existing conditions like diabetes or heart disease. These conditions can complicate recovery and increase the risk of developing PICS. People on ventilators for a long time or those who experience delirium while in the ICU are also at higher risk for PICS. Delirium can cause confusion and long-term cognitive issues. Medications used in the ICU, while life-saving, can sometimes contribute to muscle weakness or mental fogginess. These side effects can hinder a patient's ability to fully recover and return to their normal life. PICS can manifest in many ways, affecting both physical and mental health. Muscle weakness and fatigue are common. Many experience difficulty breathing, even with simple tasks like, say, climbing stairs. Sleep disturbances are also prevalent, with insomnia and nightmares being common occurrences. Cognitively, people might struggle with memory, attention, and concentration. These difficulties can make it challenging to return to work or manage daily activities. Emotionally, PICS can lead to anxiety, depression, and post-traumatic stress disorder. PICS impacts both the mind and body, often in interconnected ways. Physical weakness can lead to frustration and a sense of helplessness. Cognitive difficulties can make it hard to engage in social activities, leading to isolation and low mood. The emotional toll of PICS should not be underestimated. The experience of being critically ill and hospitalized can be traumatic, leading to flashbacks, nightmares, and anxiety. Family members may also experience emotional distress as they witness their loved one's struggles. Recovery from PICS is a journey that looks different for everyone. It can be a long and winding road, filled with both challenges and triumphs. It takes time and patience, and often requires a great deal of perseverance and resilience. The good news is that with the right support, individuals can overcome the challenges of PICS and live full and meaningful lives. Small victories should be celebrated along the way. Treatment often involves a multidisciplinary approach, including physical therapy to regain strength and mobility, which is crucial for rebuilding physical health, occupational therapy to improve daily living skills, helping individuals to regain independence in their everyday activities, and counseling to address the emotional impact of the experience, providing a space to process feelings and develop coping strategies. Support groups provide a safe space for survivors and their families to share their experiences, connect with others, and find hope. These connections can be incredibly powerful and healing